Welcome to Adapt Place. The cardiac portion of the critical care nursing exams is the most important, and that can determine fail or pass. This rapid review is for you. This is video number 7. I just lead you to a strong key aspect concept of cardiovascular in a very short form rapid review. 3 questions, boost your knowledge. Let's get to it with test-taking strategy and mnemonics. First question. Client is in the ICU, right? Is receiving intravenous Milrinone infusion for what? Heart failure. I give you a medication. I told you what it is for. Which of the following clinical findings are not expected? Effect of what? Milrinone. Select out apply. What do you need to know is the medication and what is it used for? The buzzword for that medication is this. Milrinone is, what does it do? Causes vasodilation, venodilation, and is an ionotrope. It's a phosphodiesterase inhibitor. That's how it does its function. If I'm going to cause vasodilation, I'm going to decrease your systemic vascular resistance. That's number 1. If I'm causing veno and vasodilation, then I'm going to cause hypotension. The same thing. If I'm an ionotrope and I'm decreasing your I'm causing venodilation, vasodilation, I will improve your cardiac output. So it's your stroke volume. Bradycardia is not associated with Milrinone. It may cause tachycardia, reflex tachycardia. So number 4 is wrong. Peripheral vasodilation is the same thing as decreased systemic vascular resistance. Sometimes the test makers give you this information. They want to test your knowledge. 1 in 6 are saying the same thing. If I'm decreasing the vascular resistance in the vein in the artery, there's no way my pulmonary system will have increased pressure. Therefore, 7 is not expected. It should have decreased pulmonary vascular resistance. That's why we use this medication for heart failure. Therefore, which of this is not expected? Number 4 and 7. Once again, Milrinone causes vasodilation, venodilation, and is an ionotrope. It does its job using phosphodiesterase inhibition. This is the concept you need to master. Next question. A lot of information. Don't worry. Go for the buzzword. Which hemodynamic finding on the pulmonary artery catheter is most consistent with this condition? What is happening? The client is in the ICU, develop what? Sudden onset of what? Hypotension, muffled heart sound. Does that give you a buzzword? JVD, I've given you the Beck's triad. The next note, pauses paradoxical, right? On what? Assessment, another assessment. The bedside echo shows large pleural effusion with right atrial collapse. Put the content together. I know you know this. This is cardiac tamponade. Classic symptoms. What do you think if I put a pulmonary artery catheter in you, what is going to happen? Equal pressures in the right atrium, ventricular diastole, and PE occlusion pressure, elevated cardiac output with low systemic vascular resistance, increased stroke volume with wide impulse pressure, the low right atrial pressure with the elevated cardiac output. Forget about all these words. Go for the concept. Use concept to pick an answer. I know you have tamponade. Therefore, the pressures in the ventricle and the atrium are going to be the same. That's why your systolic and your diastolic is going to be the same. Your pulse pressure are not going to be wide. 3 is wrong. It's going to cause what? Narrow pulse pressure, and I don't expect increased cardiac output. Your cardiac output is not going to go up. Your systemic vascular resistance, yes, is going to decrease. What is the right answer? Equal pressures in every system. Therefore, in tamponade, there's impaired ventricular filling leading to equal pressures in all chambers. That's the buzzword. And this is caring for a client with intra-aortic balloon pump who report tingling in the left foot, right? What is the next most appropriate initial action? Check the peripheral pulses and assess for signs of limb ischemia, reposition the client to improve circulation, increase the rate of the inflation of the pump, or check an ankle brachial index. Think about it. The idea of intra-aortic balloon pump is to improve your cardiac output. But the problem is it can cause distal emboli. that go into your lower extremities that can cause ischemia. This patient complained of tingling in the left foot is an ischemia. But what do? Initial means initial. You don't have to go anywhere. You walk in, this is what you see. I can do something right there. Checking pulses, reposition the patient, increasing the rate, or checking ABI. I can tell you ABI takes some time. You got to go get ultrasound. You got to go get so many things to do this. Even though it's okay, we'll assess pulses, it's not the best one. I can check pulses with my hand easily and assess for limb ischemia. Is the leg foot blue? If you increase the rate of the pump, it's going to worsen the situation. Repositioning, this has nothing to do with repositioning. Let's taking strategy concept on the cardiac, cardiovascular, critical care nursing exams. This is practice question, helping you learn them. This is the right answer. It's for checking pulses. Thank you for following the series of the cardiovascular aspect, the cardiac aspect of the critical care nursing exams. Take care and see you later in the next video. Best of luck.